Good evening and welcome to Choosing a Medicare Supplement, sponsored by Hoag Hospital and the Hoag Medical Group and Hoag Physician Partners. The Hoag Medical Group and Hoag Physician Partners is an excellent team of doctors that provide internal medicine, family practitioners, doctors, a osteopath, and they have an excellent team of specialists that will treat over 30 different specialties. My name is Derek Tarvin, and I've had the honor and privilege of working with Hoag Hospital for over 25 years as their outside insurance consultant. And we have a family business, an office in Costa Mesa, and we counsel everybody on Medicare, Medicare options, choosing the different Medicare plans. We can help review your current coverage and compare that to individual plans. Hey Max, how's it going, buddy? Anyhow, today we'll be going over what is Medicare, signing up for Medicare, Medicare Supplements, also known as Medigap plans, Medicare Part D prescription drug plans, extra help, and various enrollment timeframes. So first of all, what is Medicare? Medicare, also called Original Medicare, is health insurance for persons that are age 65 or older, or any of those that are under age 65 and have received disability benefits for more than 24 months, or any age persons that have end-stage renal disease or Lou Gehrig's disease. Medicare has four different parts. Part A is your inpatient services. Part B is where all your medical and outpatient charges and services fall under. Part C is what they consider the Medicare Advantage plans, and they can be a Medicare Advantage HMO or PPO. And Part D is what they consider the prescription drug coverage. Only Medicare Parts A and Parts B will appear on your red, white, and blue Medicare card. And there's a sample on your screen when you receive it, what it will look like. So Medicare Part A, this is where your inpatient services fall under Original Medicare. Most people do not pay a premium for Part A of Medicare. It was paid by you or a spouse through payroll taxes while working. And Part A of Medicare helps cover inpatient care in hospitals, skilled level of nursing care in nursing facilities, hospice, and very limited at-home medically necessary home health care. Part B, this is where all your medical services, whether you're an inpatient or outpatient, fall under. Most people do pay a premium for Part B of Medicare. The standard premium for Part B of Medicare this year is $148.50 per month. And the premium for Part B of Medicare is deducted from your Social Security benefits if you're receiving it. Otherwise, they'll bill you quarterly by mail until if and when you start drawing Social Security. And at that time, your Medicare premiums for Part B will be deducted automatically monthly. Part B of Medicare helps cover your medically necessary doctor services, outpatient care, tests, durable medical equipment, limited home health care, preventive services, and more. Those that are higher Medicare income beneficiaries will unfortunately pay more for your Part B of Medicare. Social Security looks at your tax returns at your modified adjusted gross, and they always look back 2 years. So for the year 21, look at your 19 tax return. For the year 22, look at your 20 tax return. And those that file an individual tax return and 2 years ago your modified adjusted gross was less than $88,000, they'll charge you the standard Medicare premium of $148.50. Those that file a joint tax return and your modified adjusted gross 2 years ago is above $176, they'll charge you more for your Part B of Medicare based on that year's filings. It's called an income-related monthly adjustment amount, or IRMA. And the different levels that one can pay are on your screen to study. And they can go as high as this, what you see on the bottom of your screen. And then Social Security, they audit it every single year. So your Medicare premiums can go up or down based upon your filings. And if your income has gone down, and obviously they're basing it on 2 years ago, give Social Security a call and appeal it, and they most likely will lower your Medicare premiums based on your current financial status. And because again, they're basing it on 2 years ago on your income. And if your income was much greater 2 years ago and it's gone down currently, give Social Security a call, and they most likely will lower your Medicare premiums based on your current status. Otherwise, they'll audit it every single year. So signing up for Original Medicare. Original Medicare, usually starts on the first day of the month that you turn age 65. Unless your birthday falls on the 1st, then they actually backdate it a month. If you're receiving Social Security or Railroad Retirement benefits, you'll automatically get your Medicare card in the mail 3 months before your effective date or the 25th month of receiving disability benefits. if you're in these situations and don't receive your card in the mail, give Social Security a call. The number is on your screen, and if you're going to call them this time of year, it's probably better to call the local Social Security office, most likely near Mission Viejo or Fountain Valley, because they're a lot quicker to get through to this time of the year. But if you do call them, Social Security, they're very friendly, they're very helpful, and they're very knowledgeable. And currently they're open locally 8 to 4:30 Monday through Friday. If you're not receiving Social Security or railroad retirement benefits, you actually must sign up with Social Security to get your Medicare card. And there's a couple ways you can do that. You can enroll online through ssa.gov. On Social Security's homepage, there is a tab to get you to Medicare Enrollment, and you'll just follow the steps, and it takes about 10 or 15 minutes, pretty straightforward. If you have any difficulties online or have any questions regarding enrolling into Medicare, original Medicare A and B, give Social Security a call and they can help you walk through it. So there is an initial enrollment period for signing up for Medicare. You can sign up for original Medicare 3 months before the month you turn age 65, which includes your birthday month, up to 3 months after your birthday month. If you sign up within 3 months before your birthday month, Medicare will start on the first day of your birthday month that you turn 65. If you sign up during your birthday month or within 3 months after your birthday month, Medicare will start 1 to 3 months after signing up. If you miss the initial enrollment period for signing up for original Medicare, there is a general enrollment period that occurs every January 1st through March 31st. And the coverage will start on July 1st, and you may incur a late enrollment penalty. So there's other scenarios for signing up for Medicare, original Medicare, for those that are covered by employer-sponsored group health coverage. If you're covered by an employer-sponsored group health plan, and it's based on current enrollment, and there's more than 20 employees, you can delay signing up for Medicare Parts A and or Part B with no penalty. However, whichever happens first, whether if employment terminates or group insurance terminates, you have 8 months to enroll into Medicare Parts A and Part B with no penalty. So if you're employed, covered under group insurance, there's more than 20 employees, or you're dependent and your spouse is still working and you're covered under their group insurance, there's more than 20 employees, you can go ahead and delay signing up for Medicare Parts A and Part B until either employment terminates or the group insurance terminates, whichever happens first. So oftentimes those that are still working cover group coverage, or you're the spouse and your spouse is working and they're covered under group employment and you're covered under group employment coverage for health insurance, you can delay Medicare Parts A and Part B. But most people will sign up for Part A of Medicare if you're eligible for it and you're still working and there's more than 20 employees. You can go ahead and sign up for Part A and delay Part B of Medicare. There's no premium for signing up for Part A of Medicare, but definitely delay Part B of Medicare until employment terminates or group insurance terminates. If there's more than 20 employees, you're still working and they're covered under the group insurance. Always check with your benefits advisor, Human Resources, see how Medicare coordinates with your group insurance. But typically the rule of thumb is if you're still working, there's more than 20 employees covered under group insurance, you can delay Medicare Parts A and Part B with no penalty. And most likely sign up for Part A because there's no premium for it. Those that have Part A of Medicare and need to sign up for Part B of Medicare later on, there'll be 2 forms that need to be filled out. One you fill out and one you and your employer fill out, and they'll sign you up for Part B of Medicare when such time is necessary. So again, if you're working, covered under group insurance, there's more than 20 employees, you can delay signing up for Medicare A and or B. But most people sign up for Part A because there's no premium for it. And then in the future, when you do need to sign up for Part B of Medicare, you and or your spouse, there'll be 2 forms to fill out. One you fill out, one you and your employer fill out, and you submit those to Social Security, and they enroll into Part B when such time is necessary. We have those forms in our office, or you can get them online through Social Security. So let me go back a slide. So typically the rule of thumb is if there's more than 20 employees, you're still working, covering group insurance, you can delay Medicare Parts A and a Part B. There's not a slide on it, but if there's less than 20 employees, you're covered under group insurance, still working. Most of the time, Medicare becomes primary if there's less than 20 employees. So if you're still working, covered under group insurance, there's less than 20 employees, more often than not, Medicare A and B becomes primary, and you'll need to enroll into Medicare Parts A and Part B. If there's more than 20 employees, you can delay Medicare Parts A and or Part B. Again, always check with your human resource or benefits advisor to see how Medicare according to the group insurance. So those that have a health savings account contribution by your employer and you're eligible for Medicare, you're still working, most often you're going to want to delay signing up for Medicare A and or Part B because it can have a tax implication if you sign up for Part A and you're receiving this type of health saving contribution by your employer. But again, you're not going to be penalized if there's more than 20 employees, covered under group insurance. You can delay Medicare Part A and or Part B. If you don't have any health savings account contribution, you can go ahead and enroll into Part A and then enroll into Part B when such time is necessary. But if you have some type of health savings account contribution by your employer, always check with your benefits advisor to see how enrolling into Medicare Part A can affect your health savings. But if there's no health savings account contribution, go ahead and enroll into Part A and delay Part B until such time as necessary. So those that are covered by COBRA. COBRA is kind of a tricky one. It's a continuation of your group insurance once employment has ended. And COBRA can usually run a term of 18 months, sometimes up to 36 months in special circumstances. So even though you may be eligible for COBRA for 18, sometimes 36 months, if you're eligible for Medicare and you're on COBRA, make sure you enroll into Medicare Parts A and Part B within 8 months of being eligible for COBRA, once your Medicare eligibility. So if you're on COBRA and you become Medicare eligible, make sure you enroll into Medicare A and B, even if you stay with COBRA to term, because employment has ended and it fits one of the two criteria for signing up for Medicare with no penalty. Either group insurance ended or health insurance has ended or the employment is terminated. And you can stay with COBRA for a period of 18 to 36 months once employment has ended. And if you become eligible for Medicare and you're going to stay on COBRA, make sure you enroll into Medicare A and B within 8 months so you don't get penalized. And COBRA can be very expensive. So if you are eligible for COBRA, check out the premiums for COBRA, what the benefits are for your group insurance through COBRA, and compare that to individual insurance because it may be cheaper and as good of or better coverage for individual Medicare plans. But again, if you're eligible for COBRA and use COBRA and become eligible for Medicare, make sure you enroll into Medicare within 8 months of being enrolled into COBRA because you don't want a penalty. So now we're going to discuss the Medicare supplements, also known as Medigap. Medicare supplements, also known as Medigap, they supplement original Medicare and pay secondary to Medicare. With a Medicare supplement, you can choose any doctor, any specialist, any hospital nationwide that takes Medicare patients. Referrals are not required to see specialists, and prior authorization is not required for services. The Medicare supplement plans range from plans A through N, and they're all standardized Medicare supplements that are sold by various insurance companies. So different companies will charge different rates for the same standardized Medicare supplement plans. With the Medicare supplement plans, they have plans A through N, and you will pay a monthly premium for the Medicare supplements on top of what you pay for your Part B of Medicare. You're enrolled in Medicare Part A, and you're enrolled in Medicare Part B, and you will have a separate premium for the Medicare supplements on top of what you pay for Part B of Medicare. The Medicare supplement plans, they range from plans A as in Apple to N as in Nancy. And we have this Medicare supplement comparison chart that is put out through Hoag Hospital. And if I open this up here, on the left, these are two parts of original Medicare. And these are the various Medicare supplement plans that for comparison. And on the next slide that you see on your screen, this is the chart that I'm holding. And on the left, these are two parts of original Medicare, Part A and Part B. And then the various Medicare supplement plans are on here for comparison. And we can email you this chart, you can contact Hoag, or you can print it out from your screen. So we'll go over the various Medicare supplement plans and what Medicare covers. So on the left of your screen, this is your original Medicare, Parts A and Parts B. The most comprehensive Medicare supplement plan that is offered right now is Plan F. There's two variants of Plan F, and not everybody is now eligible for Plan F. Anybody who's new to Part A of Medicare as of January of 2020 or beyond is not eligible for Plan F, which is the highest coverage. But don't fret. There is Plan G, which is the closest in benefits to Plan F. They're almost identical. So we'll go over Plan G, what the benefits are, and then we'll kind of cut over to Plan F, what the difference is. There's two variants of Plan G. There's a traditional Plan G, and there's what they call an extra or innovative Plan G. The traditional Plan G and the innovative or extra Plan G have the same medical coverage, the same doctor access, and the same claims payment. It's just with the extra or innovative Plan G, it includes routine vision and hearing benefits that traditional G doesn't cover. And the extra G has an additional bell and whistle that the traditional G doesn't have. It covers over-the-counter items, and they give a $100 benefit towards over-the-counter items as a mail-order program. But both the Plan Gs have identical medical coverage, and we'll go over what that is. So with any Medicare supplement plan, your original Medicare A and B are primary. And if you're hospitalized as an inpatient, your Part A of Medicare is going to cover this Part A hospital deductible of $1,484. The Medicare Supplement Plan G covers that inpatient hospital deductible each and every time. This Part A inpatient hospital deductible could actually be met more than once in a calendar year. If you're admitted to the hospital and then you're released, and you're out of the hospital a period of 60 consecutive days or more than readmitted, then Medicare requires a new Part A hospital deductible, or new benefit periods they call it. But the supplement, Plan F and Plan G, will cover those hospital deductible each and every time. You don't have to worry about it. Besides inpatient hospitalizations under Part A of Medicare, fall skilled nurse facilities. If you're in the hospital a period of 3 days or more, and you're released into a skilled nurse facility, and you're receiving such as physical therapy, speech therapy, drug therapy, occupational therapy, and your condition's improving and you're responding to treatment, that's what that is considered skilled nursing. And Medicare Part A covers the first 20 days 100%. If you're still in the skilled nurse facility for days 21 through 100, Medicare covers it, but the copayment of $185.50 per day for days 21 through 100. And the supplement, Plan F and Plan G, will pick up those days 21 through 100 of skilled nursing, so you're not responsible for that. If you're released from the skilled nurse facility for 60 consecutive days or more than readmitted, these 100 skilled nursing days will renew or start over. And then the last benefit under Part A falls hospice care. Plan G or Plan F will pick up any co-payments for hospice care that Medicare doesn't cover. Now, even if you're in the hospital or skilled nurse facility, and if your outpatient or medical charges always fall under Part B, and that's the one they charge a premium for. Part B of Medicare covers all your doctor visits, specialists, lab, x-ray, diagnostics, MRIs, PET scans, CAT scans, chemotherapy, radiation therapy, dialysis, ER, ambulance, surgeons, assistant surgeons, radiologists, pathologists, anesthesiologists, your outpatient occupational physical speech therapy, doctor visits in the hospital, outpatient surgeries, durable medical equipment, preventive services, or medications that are administered in a facility by a provider fall under Part B of Medicare. It's just the drugs that one fills at the pharmacy or mail order always fall under a separate Part D drug plan, which we'll talk about briefly in a couple slides from now. Part B of Medicare covers 80% of the Medicare approved amount. The providers will always bill one amount, and then they send the claim out to Medicare initially. Medicare usually lowers that fee and sets an approved amount. And for any Medicare approved amount, Part B of Medicare covers 80% of that, and Plan F and Plan G pick up the remaining 20% if you follow the chart over to the right. And to the right, towards the bottom, Plan G and Plan F will also cover what they consider excess charges 100%. And what they mean by excess charges is any providers that take Medicare, they may or may not take what's called assignment. If the providers that take Medicare accept assignment, they don't charge above what Medicare approves. They take that as payment in full. But if the providers want to get paid a little bit more than what Medicare approves, they will not take what's called assignment. So those providers that take Medicare that don't take assignment, they'll charge 15% above what Medicare approves. And that amount that providers charge above what Medicare approves, if they don't take assignment, is called excess charges. And Plan F and Plan G cover the excess charge 100%. So you don't need to worry if they take assignment or not because it's covered 100%. You should want to make sure they take Medicare because Medicare is your primary insurance. And if they don't take Medicare, period, you want to find a different provider. And then with Plan G, the first time if your medical service is in a calendar year, this year, there's a nominal Part B deductible that you pay. So your responsibility of the cost of insurance for medical with Plan G, either the variants, is this year you have a $203 deductible and then you're covered 100%. With Plan F, it pays that nominal deductible, and that's the only difference in the benefits between F and G is Plan G, you pay that nominal deductible, and Plan F pays that. Other than that, they're identical in their medical coverage. That Part B deductible creeps up a little bit each year. Last year, that Part B deductible, if you had to pay it, was $198. I think before that, it was $184, $167, and so forth. That $203 deductible next year, I believe it was $217. So it doesn't creep up much, but does go up a little bit. So with Plan G, after that deductible, minor deductible is met, you're covered 100% for a Medicare approved charge. And with the different companies, any companies that offer Plan G, the medical benefits are identical, or offer Plan F, all the medical benefits are identical. You can access all the same providers, and they all pay the same claims. It's just different companies charge you different rates for the same standardized Medicare supplement plans. So if you know what plan you're interested in, seek out the company that's got the better rates because they're all identical medically, same doctor access, same claims payment. They just charge you different rates for the same standardized Medicare supplement plans. Currently, Blue Shield of California has the more cost-effective rates for the Plan G, and only Blue Shield of California offers an extra G, and Health Nets offers an innovative G. At age 65, if you're new to the typical premium for Blue Shield's traditional G initially is $141 per month, and the extra G is $155 per month. And if you're new to Part B of Medicare, they extend a teaser rate of $25 per month for the first year, so it drops the premiums down by $25. So the traditional G is $116 a month with a discount applied, and the extra G is $130 a month. If there's two people in the same household, they apply a household discount of the same plan, the same household. They would also extend a 7% discount. Unfortunately, the premiums do go up with attained age, but you're not locked into any Medicare supplement plan for life. If you enroll into a Medicare supplement plan and then later on another company has the same benefits and a lower premium, on the bottom of your chart to the left, if you have a Medicare supplement plan in force, you can actually switch it anytime during the year if you can answer health questions no. But if you have a Medicare supplement plan and then later on another company has a better rate for the same benefits, it's highlighted down here that if you have a Medicare supplement plan in force, every year on your birthday, you have a 30-day window before your birthday, up to 60 days after, to where you can switch to a different company, or the same company for that matter, that has equal or lesser coverage and no health questions. So again, if you have a Medicare supplement plan in force and another company has a better rate, you can switch anytime during the year if you can answer health questions no. Otherwise, if you have health conditions or later on develop them, every year on your birthday, you have a 30-day window before your birthday, up to 60 days after, to where you can switch to a different company that has equal or lesser coverage and no health questions. Whatever plan you're with now may not be cost effective 5 or 6 years from down the road, but you can always switch during your birthday with no health questions. So we touch bases on this quickly. Medicare Supplement Plan F. Some companies have a traditional Plan F, and a couple companies offer an extra or innovative F. Any companies that offer Plan F or Plan G, which is the next slides, will have identical medical benefits. You can access the same doctors, and they all pay the same claims. They'll just charge you different rates for the same standardized Medicare supplement plans. The only variant between Plan F and Plan G is if they have an extra or innovative G or F. But the medical benefits for F, either Plan F are identical, and the medical benefits for either Plan G are identical. And we touch bases quickly on Plan G. Plan G this year for either variant has a $203 deductible that you pay, and then you're covered 100% after that deductible is met. Next year, the deductible for Plan G will be $217. And then after the deductible's met, you're covered 100%. The benefits for the Medicare supplement plans are guaranteed renewable for life. They can never change the benefits of the Medicare supplements or cancel it of the non-payment of premium. So the benefits for the plan stay the same. They can't ever cancel the plan of the non-payment premium. It's just, unfortunately, again, the premiums do up to attained age, but you're not locked into any plan or company for life. So now we're going to talk about the Part D prescription drug plans. With Medicare and the Medicare Supplement plans, they will cover medications that are administered in a facility by a provider. But the drugs that you fill at the pharmacy or mail order always fall under a separate Part D drug plan. We're not going to get too in-depth with the Part D drug plans. We're going to go over a general overview. But with the Medicare supplements, you must purchase a standalone Part D drug plan for your prescriptions. And the Medicare Part D drug coverage is available to anyone that has Medicare Parts A and or Part B. Medicare itself does not sell the Part D drug plans. If you have a Medicare supplement plan and want drug coverage, you actually must enroll and purchase a standalone Part D drug plan. And the Part D drug plans are sold by various Medicare-approved companies. Unfortunately, those that have higher income and pay more for your Part B of Medicare, you also will pay more for your Part D premiums. They shake the trees any way they can. So those that are individual individual tax returns, and your income on your modified adjusted gross 2 years ago was less than $88,000, you'll pay the standard Medicare Part D and Part B premiums. Those that are under 176 on a joint tax return will pay the standard Part B premium and the standard Part D premium. If you're above these income levels 2 years ago, they will charge you more for your Part B, which we saw in the previous slides, and they also will charge you more of your Part D drug plan, which is on your screen, and it can go as high as what you see on the bottom of your screen. And again, Social Security will audit your tax returns each year, so your Medicare premiums can go up or down for Part B as in boy and for Part D. And if they're charging more for your Medicare Part B and your Part D drug coverage from 2 years ago based on your income, and your income has gone down, give Social Security a call, and they most likely will lower your Medicare premiums based on your current status. Otherwise, they'll audit it every single year. We haven't gone too much in the Part D drug plans. Next year, there's 25 different Part D drug plans that are available. They all have the same coverage model, which we're not getting into during the presentation. But all the Part D drug plans have different premiums, and they tier their drugs on different formularies. And each drug plan is not going to cover your medications the same. How we make a recommendation for a Part D drug plan is if you're taking medications, we input them and get a line-by-line itemization of all the drug plans and list them from which plan is least out-of-pocket and which is highest. And that's how we make a recommendation for a Part D drug plan. If someone's not taking medications, we just recommend one of the lower cost premium plans so you have the coverage and don't get penalized for enrolling late. Because yes, unfortunately, they will penalize you if you don't enroll into Part D drug coverage, if you're eligible for it, and don't have other creditable drug coverage. It's not a big penalty, it's more of a nuisance. But if you don't enroll into Part D drug coverage and don't have other creditable coverage, when you go to enroll in a Part D drug plan, they will penalize you. The penalty is 1% for every month you're eligible for Part D drug coverage and didn't have it of the national average base premium. I think the national average base premium currently is around $35. So let's say you go 24 months without having a Part D drug plan and then enroll into one, they'll penalize you 24% of the national average premium of around $35. I think the penalty of 24% of $35 is around $8.40. So that $8.40 penalty will be tacked on to any monthly premium that you have for life. So it's not a big penalty. It's more of a nuisance, but it does not go away. So even if you're not taking medications, it's a good idea to enroll into one of the lower cost Part D drug plans so you have the coverage in case you need it and don't get penalized enrolling late. But if you are taking medications, we highly advise inputting them or having us input them to do an analysis of all the Part D drug plans because it can vary on how they cover your medications from Plan 1 to Plan 25. It can vary quite a bit. And then the drug plans, they change every single year. So whatever drug plan is cost effective 1 year may not be next year. I know I've moved on a slide, but we get real busy during this time frame reviewing our clients' drug plans for the upcoming year. every enrollment period is called the annual election period, which we're in now. It's a time frame you can enroll, disenroll, or switch your Part D drug plans or an Advantage plan, not the Medicare Supplement plans. So we get real busy during this time frame reviewing our clients' medications for the upcoming year, because whatever Part D drug plan you have this year may not be cost effective next year, whether your medications change or not. So again, I can't stress how much highly advisable it is to review your drug coverage every time during this calendar year. So now we're going to just briefly mention about Extra Help. Extra Help is a Medicare program that helps people with limited income or resources pay for Medicare drug costs. It's also called Limited Income Subsidy. It can help pay monthly plan premiums, deductibles, co-insurance, or co-payments for your Part D and also your Medicare. If you think you qualify, give Social Security a call and discuss your situation with them. I think that is, oh no, we got the various enrollment timeframes for the different Medicare supplements and the Part D drug coverage. So we're going to discuss turning 65 or new to Medicare, leaving employer-sponsored group health plans to enroll in a Medicare supplement plan or a Part D drug plan, a birthday enrollment period, which we briefly discussed, and a 12-month trial right. So those that are turning 65 and new to Medicare and would like to enroll into a Medicare Supplement or Medigap, you have guaranteed issue where they don't ask, or you don't have to answer any health questions for a period of 3 months before you turn 65, the month of, up to 6 months after your Part B of Medicare goes into effect. And to enroll in a Medicare Supplement, you must be enrolled in Part A of Medicare and enrolled in Part B of Medicare and paying your Part B premiums. So if you're new to Part B, you have 3 months before your Part B of Medicare goes into effect, the month of, and 6 months after to enroll into a Medicare Supplement, no health questions. Those that are leaving employer-sponsored group health plan and would like to enroll in a Medicare Supplement plan, you have 63 days to enroll into a Medicare Supplement with no health questions, unless you're new to Part B of Medicare. Then you have 6 months. So if you're leaving employer-sponsored group health coverage and you would like to enroll into a Medicare Supplement and your Medicare A and B has been in effect for some time, you have 63 days to enroll into a Medicare Supplement plan with no health questions, or 6 months if you're new to Part B of Medicare. Most people are going to coordinate your Medicare and the individual Medicare insurance to start the day after your group insurance terminates. But if you miss that window, you do have a grace period of 63 days after leaving group insurance to enroll in a Medicare Supplement with no health questions, or 6 months after leaving group insurance if you're new to Part B of Medicare. There is a birthday enrollment that we discussed earlier that if you have an existing Medicare Supplement plan or Medigap in force, you can switch it anytime during the year if you can answer health questions no. But if you have a Medicare Supplement and you have health conditions or later on develop them, every year on your birthday, you have a period of 30 days before your birthday, up to 60 days after, to where you can switch to the same company or a different company that has equal or lesser coverage, no health questions. And this occurs every birthday anniversary. This is a pretty popular one. It's a 12-month trial right. If you're turning, and we haven't really discussed these plans, if you're turning 65 and new to Medicare and you enroll into a Medicare Advantage plan, which can be, a Medicare Advantage HMO or Medicare Advantage PPO, and you're turning 65 and new to Medicare, you actually have a 12-month trial right to try the Medicare Advantage plan out. If for any reason during the initial 12 months you're not happy with the Advantage plan or simply want to enroll into a Medicare Supplement for whatever reason, you can terminate the Medicare Advantage plan anytime during the initial 12 months and enroll into a Medicare Supplement and a Part D drug plan with no health questions. If you have a Medicare Supplement plan and then in the future you'd like to enroll into a Medicare Advantage plan, we would enroll you into the Medicare Advantage plan during the annual election period, which is between October 15th through December 7th. The Advantage plan becomes effective January 1. And from January 1 through December 31st, if you're coming out of a Medicare Supplement and trying an Advantage plan for the very first time, they give you a 12-month trial basis at that time to try the Advantage plan out. If you're not happy with the Advantage plan or simply want to get your Medicare Supplement back for whatever reason, you can terminate the Advantage plan anytime during the initial year and get your Medicare Supplement back and a drug plan with no health questions. Unfortunately, they don't give you both 12-month trial basis. They give you one or the other, but it's nice that they do that. If you stay with the Advantage plan past the initial year, they lock you into the Advantage plan, and you may be subject to health questions going to a supplement at that time. Unless there's some other triggers that may or may not occur. And the big one is if you move out of the county, you have an open enrollment guaranteed issue, whatever plans offered in that area, whether it's a different county or different state, you can enroll into any Medicare Advantage or supplement that's in that area. And there's other guaranteed issue scenarios that may occur, but they don't all apply, and we'd be glad to go over them in our office. If you have any questions about the Medicare supplements or Medicare or the Part D drug plans, please contact us. We counsel everybody. There's no fee for all service, and we'd be glad to hear from you. And there are other enrollment timeframes for the Medicare Advantage plans to enroll into a Medicare supplement, and this is a pretty new one. It's called a Medicare Advantage open enrollment period. This only applies to existing Medicare Advantage plan members only. Every January 1st through March 31st, if you have a Medicare Advantage plan, you can actually disenroll from the Medicare Advantage plan, enroll into a Part D drug plan, and apply for a Medicare supplement plan. If you're going to use this time frame, the Medicare Advantage open enrollment period, to apply for a Medicare supplement plan, we highly advise enrolling into a Medicare supplement plan and make sure you get issued, that they approve you first, because they can ask health questions if you're not in a guaranteed issue scenario. And if you use this scenario to apply for a Medicare supplement, make sure you apply for the Medicare supplement and get approved before enrolling into a Part D drug plan. If you enroll into a Part D drug plan during this time frame, your Medicare Advantage plan will be automatically canceled the following month, and we don't ever want to leave anybody without insurance. So again, I can't stress enough, you're going to apply for a Medicare supplement plan during this force, make sure you apply for the Medicare supplement, get approved, and then apply to a Part D drug plan after you get approved by the Medicare supplement. Because again, enrolling to a Part D drug plan will cancel your Medicare Advantage plan automatically the following month. So make sure that you get approved by the Medicare supplement and then apply for the drug plan. So now we're going to take some questions. If you have any further questions, please give us an email or email me at my office or give us a call, and we'll be glad to set up an appointment. We have an office in Costa Mesa, and we usually schedule about 2 hours for an appointment to go over all your different options. And now we're going to be handing some questions for the information that we went over. Thank you. You guys must have been attentive. We only have one question. So I have or had a Medicare Advantage plan and went back to work and then covered by employer group health plans. Are there any pitfalls when I finally retire and sign up for Medicare? Not if there's more than 20 employees. If you're covered under group insurance and there's more than 20 employees, you can delay your Medicare Parts A and Parts B if you have it. It sounds like you might have it because you had a Medicare Advantage plan. And you can terminate your Part B of Medicare if you're covered under group insurance, there's more than 20 employees. And then when the group insurance terminates, you can enroll back into Medicare Part B and either enroll into a Medicare Advantage plan like you had, or a Medicare Supplement plan like we went over tonight, and a drug plan when the group insurance terminates. But you have guaranteed issue if your Medicare A and B stays in effect for 63 days to enroll in a Medicare Supplement once your group insurance ends. And for whatever reason, if you're going to enroll into another Medicare Advantage or Part D drug plan to go along with the Medicare Supplement, you've got 60 days after your group insurance terminates to enroll in an Advantage plan or a Part D drug plan. But you have 63 days to enroll into a Medicare Supplement plan if your group insurance terminates. But yeah, thank you for that question. Thank you. It says, am I available for assessing and reviewing one's present Medicare Supplement Part D drug plan? Yeah, absolutely. We'll be glad to review your current Medicare Supplement plan with whichever carrier you have and see if there's another Medicare Supplement carrier that has a more attractive rate for your current coverage. And we can definitely review your Part D drug plans. They do change every single year, the Part D drug coverage. So whatever drug plan is cost effective one year may not be next year based upon the changes, and your drugs may change. So yeah, we'd be glad to do an analysis of your Part D drug coverage for the upcoming year and every year, and also review your current Medicare Supplement plan and compare that to other companies that offer the coverage. Thank you. And it looks like we have a couple more questions. Thank you. Okay. It says, why focus just in F and G, plans A through A and H through N? I don't even know some of the companies that offer Plan B, and I have not enrolled anybody in a Plan C in gosh knows how long. Plan A is the lowest coverage. It doesn't cover your hospital deductible, which is important. It doesn't cover your skilled nursing benefits, which is important. The Part B deductible is not a big deal, and it does not cover excess charges under Plan A in case they don't take assignment. By far, the most popular plans are F or G. I've never enrolled anybody in plans K or L, and very infrequently do I enroll in someone in Plan N. We can enroll in other plans, but they're just not very popular. And Plan N, even though it's lesser coverage than Plan G, ironically, the premiums are the same or lower for Plan G. But it's just anybody who's new to Medicare A as of January 2020 or beyond is not eligible for Plan F or Plan C. And we focus on Plan G. But that's a good question. But most often than not, people are going to enroll in a Plan F if they're still eligible, or Plan G and not the other Medicare supplement plans. But we can definitely discuss those benefits with you. So this is a common question that we get. Do we recommend a Medicare supplement as opposed to a Medicare Advantage for those who live in other states part-time or half the year? So with the Medicare supplements or Medigap plans, you can go to any doctor or any facility throughout the United States that takes Medicare patients without a referral or authorizations. And so they're nationwide plans. They're good everywhere throughout the United States for chronic care and immediate care. With the Medicare Advantage plans, they do work worldwide for emergency or urgent care. If you have ongoing chronic care with the Medicare Advantage plans, the HMO plans, you definitely want to come back to your service area where your medical group is, like say Orange County for Hope Medical Group, etc. But the Medicare Advantage plans, they do work if you're traveling. They do cover you worldwide for your emergencies or urgent care. So the Advantage plans, if life threatening illness, heart attack, stroke, break a leg, you go to the nearest facility worldwide, you're covered. And they do treat you for urgent care, minor stitches, flus, colds, etc. But if you have ongoing medical care with the Advantage plans, you want to come back to your service area, especially with the HMO plans. But both will work if you're traveling or living abroad. But the Medicare supplements will treat you for all your care with your traveling throughout the United States. And the Medicare Advantage HMOs will treat you for emergency or urgent care if you're traveling. In fact, that's worldwide coverage as well. I had Medicare A and B and went back to work and enrolled in employer group health coverage. And there's more than 20 employees. Is there a penalty? No, there's not. If you had Medicare A and B and an individual Medicare plan and went back to work or work that has employer group health coverage and there's more than 20 employees, yeah, you can opt out of Medicare A and B, it sounds like you have, or just B. And then when the group insurance terminates or the employment terminates, at that time, you want to re-enroll in a Medicare Parts A and or Part B in an individual plan when your group insurance or health coverage terminates. But yeah, if you had Medicare A and B, went back to work, there's more than 20 employees, you can opt out of Medicare A and or Part B and then re-enroll later on when your group insurance terminates or the employment terminates without any penalty. That's a good question. Thank you. Well, this is another question about the difference between Medicare Supplements and Medicare Advantage plans. Today, we just solely went over the Medicare Supplement plans. We do another class called Medicare Basics, which goes over all the options for Medicare, Medicare Supplements, and Medicare Advantage plans, and the Part D a little bit more in detail with the Advantage plans and the Part D drug coverage. And we offer all the plans in our office. We can go more into detail if you give us a call or an email. But the major difference between a Medicare Supplement and a Medicare Advantage, say HMO, is with a Medicare Supplement plan, your original Medicare A and B is primary, and you have a Medicare Supplement, which is secondary to your original Medicare. And you pay a premium for Medicare A and B, whether you have a supplement or an Advantage plan. It's just with the Medicare Supplement plans, you have a second and third premium besides your Medicare. You have your Medicare Part B premiums, you have a premium for the Medicare Supplement, and you have a third premium for a drug plan, Part D drug plan. And then you can self-refer to any doctor or any facility throughout the United States Medicare patients, and your coverage is the same. The Medicare Advantage plans are typically the HMO type plans. There are Medicare Advantage PPO plans that are offered. But typically with a Medicare Advantage plan, it would be a Medicare Advantage HMO. And there are no premiums for most Medicare Advantage HMOs here in Orange County for the medical or the drug coverage. The Medicare Advantage HMO plans, they're a little more restrictive on how you access the providers. They work just as well as the Medicare Supplement plans. It's just with the Medicare Advantage HMO, the insurance companies are the umbrellas. They provide the medical benefits. And then there's many, many different medical groups that contract with the Advantage companies. And depending on what medical group you choose your primary doctor from, with the Advantage companies dictates what doctors and hospitals you have access to. So again, we didn't really go into this information, but if you have a Medicare Advantage HMO and you want to access Hoag Hospital, make sure you choose your primary doctor from the Hoag Medical Group. The Hoag Medical Group and Hoag Physician Partners, you can use a Medicare Supplement or PPO plan, but if you have an HMO plan, especially Medicare Advantage HMO, you want to make sure you choose your primary doctor from Hoag Medical Group and receive all your services through Hoag and the Hoag Physicians and Hoag Physician Partners. And with the Medicare Advantage plans, they do cover you worldwide for urgent care or emergencies. But the major difference between a Medicare Supplement is with the Medicare Supplement, you pay a monthly premium for the medical drug and the drug coverage on top of what you pay for your Medicare. With the Medicare Advantage plans, especially the HMO plans here in Orange County, most of them do not have a monthly premium for the medical or the drug coverage. And then you may or may not have a copayment depending on what services are rendered. And you have a primary care doctor that you see for all services. And if you need to see a specialist, the primary doctor refers you to a specialist within the medical group you choose your primary doctor from. If you'd like some more information, please contact us on that. Okay, so do the Medicare Supplement plan premiums rise with age or health conditions, and how high can they go? Yeah, the Medicare Supplement plans do go up with attained age. They don't base it on your health. Some plans have smoking rates and non-smoking rates. If you're under one of the 17 different guaranteed issue scenarios, it doesn't matter whether you have a smoke or not. You have a guaranteed issue, you don't have to answer any health questions. If you're not in a guaranteed issue scenario, they can rate you up for being a smoker. Some companies do. Other than that, they do not rate you up based on health. It's the same cost based on what company you're with, what plan you're with, what your age is, and what region you live in. The premiums for Plan G, off the top of my head, they can go to around $280 roughly. I don't have them all memorized right now. And for Plan F, they can go up over $400 a month, depending on, for age 80 and over. You're not locked into any Medicare Supplement plan or company for life. Again, you can always switch during your birthday month with no health questions to a company that's got equal or lesser coverage. Whatever Medicare Supplement plan or rate we're quoting today, unfortunately, they're not set in stone. Not only do the companies have attained age increases, they have across-the-board increases where they raise everybody's rates every 2 or 3 years. So whatever Medicare Supplement plan we're looking at or quoting today, unfortunately, they're not set in stone. But again, you can always switch to a different company that has equal or lesser coverage during your birthday anniversary and every birthday anniversary if your plan has a better rate with a different company for the same benefits. Oh, we got one more. And is flexibility in choosing care the major advantage selecting a Medicare Supplement or an Advantage plan? Typically, yeah. With the Medicare Supplement plans versus the Medicare Advantage HMO, you can pick up the phone and make an appointment with any doctor, any facility that takes Medicare throughout the United States without a referral or authorization for procedures. With the Medicare Advantage, it can be Medicare Advantage HMO or PPO. With the Medicare Advantage plan, you are limited to your primary doctor and specialist through your medical group. You can change your primary doctor or medical group throughout the year, but typically with the Medicare Advantage HMO, You receive your care through your primary doctor and get a referral to the specialist within your medical group. Unless, of course, you have an emergency or urgent care, then you're covered worldwide. With the Medicare Supplement plans, as I mentioned, you go to any doctor, any facility takes Medicare without authorization for referrals. There are Medicare Advantage PPO plans out there, but not every provider takes Medicare will take a Medicare Advantage PPO. You've got to make sure that they agree to accept the Medicare Advantage PPO. And then you'll have in-network providers with the Medicare Advantage PPO that you'll have certain deductibles, co-payments, and out-of-pocket maximums that you pay before they cover you 100%. And typically you can self-refer out of the network if they agree to take the plan, and typically have higher deductibles, higher co-payments, and out-of-pocket maximums before they cover you 100%. But the greatest flexibility of care and access to providers is a Medicare Supplement versus an Advantage plan, because again, you go to any doctor, any facility that takes Medicare throughout the United States without a referral or authorization for procedures. So you dictate your medical care with any providers out there that take Medicare. So I think that's all of our questions for today. If I didn't answer it completely, you'd like some more information or like to contact us, please email us. The information is on your screen. We do see everybody by appointment. We have a family business. We don't ever charge a fee, and we'd love to hear from you. Thanks for attending, and you guys have a great evening. Thank you.